guys, it's me, Jonna. I'm a mental health therapist, and today we're going to talk about anxiety. So what exactly is anxiety? Occasionally, everybody experiences some form of anxiety. It is a normal part of life. A lot of people confuse stress and anxiety. However, many people worry about things such as health, money, relationships. Anxiety disorders involve more than just temporary worry or fear. For people with an anxiety disorder, the anxiety does not go away and it can get worse over time. And the symptoms interfere with your daily activities. They can interfere with your work performance, your school activities, or your just general day-to-day activities. There are several types of anxiety disorders. There are social anxiety disorders, generalized anxiety disorders, panic disorders, and various phobia-related disorders. Today we're going to talk about generalized anxiety disorder. And that involves a persistent feeling of anxiety or dread, which interferes with your daily life activities. It's not the same as occasionally worrying about something or dealing with an actual stressful life event. People living with generalized anxiety disorder, they usually experience frequent anxiety for months, if not years. Symptoms usually include feeling restless, agitated. You might feel your heart palpitating. You might be sweating. You might find yourself having a hard time concentrating. You might feel irritable. Sometimes people experience headaches, nausea, or just muscle aches in general. Sometimes it's environmental, sometimes it's genetic. Usually if you have a family member that has generalized anxiety disorder, the chances are you have a percentage of getting it as well. Some people that were very shy as children, were exposed to a lot of stressful events, they're prone to getting generalized anxiety disorder. Some substances will elicit the symptoms of anxiety disorder. Drinking too much caffeine, using street drugs. Some physical health conditions too, like thyroid problems and maybe a cardiac arrhythmia, mimic the symptoms. So if you think you have an anxiety disorder or any other abnormal feeling, it's very important that you talk to your doctor. Go to a health clinic. There's a lot of telehealth doctors. Reach out, get checked. The treatments for anxiety, there are multiple therapies that you can engage in. A mental health counselor will work one-on-one with you, and they will be able to offer you individualized counseling based upon your unique needs. Cognitive behavioral therapy is the gold standard for generalized anxiety disorder, and you will learn thought-stopping techniques. You will learn how to change behaviors, deal with the symptoms. Sometimes medications can be effective short-term for anxiety symptoms. These medications are not to be used lifelong. Please see a mental health therapist to get to the underlying reasons if you do not have a medical condition for your generalized anxiety disorder. So a lot of things you could also do. There are many support groups that are offered for people with anxiety disorders, and also there are mindfulness activities. Go out, stress reduction, stress management, exercise, move, get out there. Your body's designed to move. Just get that heart pumping, clears the mind, gets the blood flowing. You'll be okay. So that, in a nutshell, is generalized anxiety disorder. In future videos, we will be talking about the other anxiety disorders and subscribe, because these are informative, brief, educational, and everybody needs to have good mental health. So, wishing you good mental health.